Welcome to What's Now, a show all about what's trending, great products, current research, and much, much more. I'm your host, Christine Napier, and today's episode is all about your health, and we're going to get started right away with early stage breast cancer. What do you need to know? And there's new information all about women who may be able to skip chemotherapy altogether. Here's more.
Some women with a common type of early stage breast cancer may be able to skip chemotherapy completely. New research shows that it's possible for certain patients to be treated with hormone-blocking therapies only, even if their cancer has spread to some of their lymph nodes. Here to talk about what this means for patients and the tests women need to ask for is Dr. Deepa Halaharvi, a board-certified breast cancer surgeon who's also a breast cancer survivor. Doctor, thanks for being here today.
Thank you for having me today.
Dr. Halaharvi, what is early stage breast cancer and what does it mean for it to have spread to lymph nodes? How has cancer generally been treated until now?
So 1 in 8 women in the United States get diagnosed with breast cancer, and it's the most common cancer around the world. And an early stage breast cancer is defined as the stage 1, stage 2 breast cancer. And about 25% of the women who get diagnosed with early stage breast cancer, the cancer actually goes from the breast to the lymph nodes. And up until now, these women were being treated with chemotherapy. And I'm so fortunate we live in a time where there's personalized breast cancer care. No two breast cancers are the same. And so, I tell my patients, always be your own advocate and ask if there is a personalized care for your type of breast cancer.
And if you or a loved one face an early stage breast cancer diagnosis, how can you determine if you need chemo or not?
So if you want to know if chemo is beneficial or not, there is this test. It's called Oncotype DX. It's a very well-studied test. And as a nerd myself, I read all about it and know all the science behind it. And it's a test that looks at the tumor biology. So it's a genomic assay that looks at the tumor biology, and it tells women the benefit of chemotherapy. If there is no benefit, then they can omit chemotherapy. And the other piece of information that this test gives us too is the risk of recurrence, is what is the chance the cancer can come back. And that's huge because women always want to know, what is the chance the cancer can come back? And this is such a well-studied test. Over 1 million women have had this test worldwide, and it accurately predicts whether one should or should not get chemotherapy.
And you're in the unique position of being both a breast cancer survivor and a breast cancer surgeon. Tell us about your breast cancer experience and how it has impacted how you care for your patients now.
Thank you. I now say I'm privileged to be a breast cancer survivor because it's made me a better breast cancer surgeon. I was diagnosed 8 months after I started working as a breast cancer surgeon. And, I was so used to telling patients you have cancer. Then, that was me, 1 in 8, gets diagnosed with breast cancer. And I went through all those, feelings, denial, anger, bargaining, depression, and acceptance. And you have to go through them in order to kind of come to terms with it. And I did. I had fears, do I need a lumpectomy, a mastectomy? Do I need chemotherapy? How is that going to impact me? As a surgeon, I need my hands. Chemotherapy can have, besides the hair fall, nausea, vomiting, neuropathies or the numbness in the fingers, and other, things that chemotherapy can cause. And I had the same fears. And so when my doctor ordered that test, which I was very familiar with this test because I was ordering it for my patients, I was so happy. And I was also few privileged women, could omit chemotherapy. And that was the best decision for me. And I still take anti-estrogen medication that decreases the risk of cancer coming back. And, this really made me more empathetic, more compassionate. And, it allows me to take my patients from being a survivor, being a new cancer patient to as not just a survivor, but I say, I want you to be a warrior. I want you to, like the day that they get told they have cancer, they're just the bottom of their life, right? So I get the privilege of taking them from that to be a warrior and find their new normal and empower them. And so I feel so privileged to be able to do that. And so that's why when I said I'm a privileged breast cancer survivor.
And Dr. Halaharvi, for women that find out they can skip chemotherapy, what type of impact could that make on their lives?
It is huge. I mean, chemotherapy, if you need it, it's very beneficial because it does reduce your risk of getting, cancer back. But if you don't need chemotherapy, you can omit all these side effects, the nausea, the vomiting, the hair loss, the infertility amongst the new young women who are getting diagnosed with breast cancer, and future development of other cancers. So it's huge if you can omit chemotherapy. So not only that, the quality of life, and that's really important more than the survival, is the quality of life. And I tell women, be your own advocate. Ask your doctor, this test, the Oncotype DX is the right test for you, or any other things that they can do for you. And we as doctors, we love it when patients come in with questions, and we just, that excites us, and we want to do even a better job taking care of them.
And what is the one piece of advice that you give to your patients when they are facing a treatment decision?
I say be your own advocate, ask questions, go to the websites, learn more about this test. And when you go in with a list of questions, that just makes you more empowered, and, just take control back, because cancer, you were not in control of the cancer diagnosis, but now you have the control of the treatment plan.
And where can we get more information?
Yes, so they can go to MyBreastCancerTreatmentorg, not just to read the information, but there's also videos that they can watch. There's a lot of great information there that they can get from this website.
Well, thank you so much, Dr. Halaharvi, for joining us today. I really appreciate your time and this important information about new treatment options for women with early stage breast cancer. Appreciate your time.
Thank you so much for having me. Have a wonderful day.